Hello everyone, and thank you for being here. My name is Lucas Chanzelo. In today's presentation, we will explore how abnormal behavior is defined and classified, different psychological approaches, common mental disorder, their sign and treatments, and finally, the importance of integrating mental health understanding into all areas of healthcare. Mental health affects every one of us, whether directly or indirectly. Abnormal psychology isn't just about diagnosing disorders. It is about understanding what happens when the mind strays from typical patterns and how they impact behavior, emotion, and thoughts. So, what exactly is abnormal psychology? It is the scientific study of mental disorder, their causes, symptoms, and how they can be identified and understood. This includes conditions that significantly disrupts a person's ability to function in daily life and that often cause distress to the individuals of those around them. But defining what's abnormal isn't always simple. According to psychological experts, there are several perspectives. First is subjective discomfort, when someone feels intense emotion, pain, or anxiety. It may signal a mental health issue, but not always. Some individuals may show serious symptoms and yet feel no distress. Secondly will be social nonconformity. This refers to behavior that defines social norms, which may seem abnormal, but being different doesn't always mean disorder. After all, many great thinkers were once labeled nonconformists. Third one would be statistical abnormality. If someone scores extreme high or low on traits like anxiety or intelligence, they may be labeled abnormal. But a rare trait doesn't always mean illness. There are two key factors to determine whether behavior is considered normal or abnormal. Firstly, situational context, referring to the social environment, behavioral setting, or specific circumstances in which an action occurs. It helps determine whether a behavior is considered appropriate or unusual. For example, is it concerning if someone talks loudly to themselves in a quiet library? Absolutely odd, is it? While at a sport game where everyone is cheering loudly, that's totally normal. This shows how the same behavior can be viewed differently depending on the situation. Secondly, cultural relativity. This also matters, and what is it considered abnormal in one culture might be normal in another. For example, hearing voices may be spiritual in some cultures. Public grieving, like wailing, is normal in some society but unusual in another. Eating insects is ordinary in many cultures but strange to some. We use harm, disruption, and unusualness as guidelines, but always with cultural understanding. How do we determine if a behavior is abnormal? Psychologists use three key criteria for abnormality. Number 1, maladaptive behavior is an action that prevents individuals from functioning effectively in their daily lives. This behavior often causes harm to the person or those around them. For instance, someone with severe social anxiety might avoid all human contacts, damaging their relationships and career prospects. Similarly, an eating disorder can lead to dangerous health consequences. The key question here isn't just about how unusual the behavior is, but rather how much it interferes with a person's ability to live a fulfilling life. Maladaptive behaviors typically creates a circle where the problematic action temporarily reduces stress but ultimately makes the situation worse. Secondly, significant impairment in psychological functioning. This goes beyond everyday stress or temporary difficulties. We're talking about losing the ability to control one's thought, emotion, or behavior in ways that severely disrupt normal activities. Considering someone with major distress who can't muster the energy to get out of bed for weeks, jeopardizing their jobs and personal hygiene. Or imagine debilitating panic attacks that makes it impossible to leave the house. These aren't just bad days. They represent breakdowns in fundamental psychological process. The impairment must be substantial and persistent, not just occasional or mild. Thirdly, atypical behavior. It involves behaviors that deviates from what statistically common or cultural expected. This includes action or experiences that falls far outside the range of typical human behavior. Example might include hallucination, where a person sees or hears things that aren't there, or delusional beliefs that persist despite clear evidence on the contrary. However, it's crucial to note that rarity alone doesn't define abnormality. Being a genius or an Olympic athlete is statistically rare but not disorder. The context matters greatly. What might seem bizarre in one culture could be perfectly normal in another. This criterion reminds us to consider both statistically norms and cultural expectation when evaluating behavior. Together, these criteria help professionals assess mental health with nuisance, balancing distress, dysfunction, and cultural context. That's why psychologists use classification tools like the DMS-5, a manual that provides standard criteria to diagnose disorders consistently. Let us now move to the foundation of how to classify mental disorder. Over to you, Mr. Wong. Please, thank you.
Thank you, Mr. Lucas. Good afternoon, everyone. My name is Wong Leong Yang. Let's dive deep into how we classify mental disorder and what puts individuals at risk. First, how mental disorders are classified using the Diagnostic and Statistical Manual of Mental Disorder. 5th edition, text revision, known as the DSM-5-TR, and second, what factor put individuals at risk of developing mental disorder. Let's begin. The DSM-5-TR is a comprehensive manual published by the American Psychiatric Association. It is one of the most widely used systems in the world for classified mental disorder. The DSM provides standardized diagnostic criteria to ensure clinicians and researchers have a common language to identify, diagnose, and treat mental health conditions. Why is the DSM-5-TR important? It ensures that diagnoses are consistent, evidence-based, and scientifically validated across clinician, healthcare systems, and countries. It also guides treatment planning, insurance coverage, and research. First, biological factors include genetic predisposition. Mental illness often run in families. Brain chemistry, imbalance in neurotransmitters such as serotonin or dopamine. Brain structure and injury abnormalities or trauma to certain brain areas. Prenatal factors, poor nutrition or exposure to toxics during pregnancy can increase risk. Second, psychological factors such as childhood trauma or abuse, personal traits like perfectionism or high neuroticism, negative thought patterns, chronic pessimism, low self-esteem, poor coping skills, inability to manage stress effectively. Third, social factors include stressful life events, divorce, job loss, bereavement, lack of social support, isolation or loneliness, socio-economic challenge, poverty or unemployment, discrimination and stigma, especially for marginalized groups. Other factors that increase risk include substance abuse, alcohol or drugs can use both trigger and worsen mental illness. Chronic physical illness, conditions like cancer, diabetes, or chronic pain. Cultural stressor, for example, migration or accumulation stress. Up next, we explore the major branch of psychology that help us understand why this disorder happened in the first place. Mr. Sunny, please.
Thank you, Mr. Wong. Hello everyone, my name is Sunny Tan Wee Chi. Today, we're diving into the world of mental health by exploring the three major categories of mental disorder: mood disorders, anxiety disorders, and psychotic disorders. These categories help us understand how mental illness impacts through emotions and behaviors and why compassionate care matters. Let's get started. First up, mood disorders. Mood disorders are defined by several persistent disruptions in the person's emotion state. Imagine feeling stuck in the deep, unshakable sadness, or swinging wildly between euphoria and despair. Major depressive disorder. This is more than just feeling sad. Imagine waking up early in the morning every day feeling like you are trapped under a heavy blanket. Simple tasks like showering or eating feel overwhelming. For example, a student might stop attending class, withdraw from friends, or lose all motivations. Next is persistent depressive disorder, a chronic form of depression where individuals experience a low mood for most of the day, more days than not, for at least 2 years. Although the symptoms are less severe than major depressions, they last longer and can still interfere with daily life and relationships. Bipolar disorder, a roller coaster of emotional extreme. During manic episodes, someone might impulsively quit their job, stay awake for days, or believe they are destined for the greatness. Then come the crash into the depressions, leaving them dry, hopeless, and unable to function. Schizophrenic disorder. Schizophrenic disorder is a milder chronic form of bipolar disorder. People with these conditions experience frequent mood swings, from mild high to mild low, lasting for at least 2 years. Although the symptoms don't meet the full criteria for the bipolar disorder, they still affect social and work life. Another recognized mood disorder is seasonal affective disorder. We call it SAD. This is type of depressions that follow a seasonal pattern, most commonly occurring in the winter months when sunlight exposure is reduced. Symptoms include low energy, oversleeping, overeating, and social withdrawal. Light therapy along with medications and counseling can be effective treatments. Childbirth-related mood disorder. But mood disruptions aren't limited to common clinical diagnoses. They can also appear during one of life's most emotionally vulnerable moments: childbirth. Postpartum depressions, PPD, a several longer-lasting form of depression that begins within weeks to months after childbirth. Symptoms include intense sadness, guilt, withdrawal from the baby, and even thought of self-harm or harming the baby. About 1 in 7 mothers experience these conditions. Example, a new mother may feel numb, crying constantly, and struggle to bond with her baby, even though society expects her to feel joy. Maternity blues, baby blues, short-term mood swing, tearfulness, and anxiety in the first 2 weeks postpartum. It affects 50 to 80% of new mothers, but usually resolves on its own without treatment. This cause is believed to be related to the hormonal change. Up next, let's shift from emotional extreme to the overwhelming grips of fear. Anxiety disorders, presented by Ms. Tara. Ms. Tara, over to you.
Thank you, Mr. Sunny. Hi, everyone. My name is Tara Tampuyun. Let's explore the anxiety disorder with me. While we all feel anxious sometimes, anxiety disorder are different. They are like a fire alarm that won't turn off, constantly signaling dangers even when they're none. Let's break down what this disorder really look like. Anxiety disorder go beyond everyday stress. They involve intense, excessive fear that's persistent, irrational, and disrupt daily life. Imagine your brain stuck in survival mode, even during routine tasks like grocery shopping or answering a call. Example, generalized anxiety disorder. Constant what-if worrying is. Imagine lying awake at 3 a.m., terrified your partner will crash their car, even thought they're just driving to the store. Physical symptoms, muscle tension, headache, fatigue. Over time, fears of another attack can lead to avoid places like mall or public transit. Panic disorder, suddenly paralyzing panic attack. Heart racing, sweating, feeling like you are dying, even when they're not real danger. Have you even met someone who avoid escalator like the plague or scream at the sight of a harmless spider? These intense, irrational fears are called specific phobia, one of most common anxiety disorder. Animal phobia involves intense fear of creatures, even if they pose no real threat. Arachnophobia, fears of spider. Imagine someone vacuuming their room 5 times because they saw a tiny house spider. Optophobia, fear of snakes. Even a photo of snake can trigger sweating of nozzle. Psychophobia, fears of dog. A person might cross the street to avoid a luscious puppy. Natural environment phobia. This phobia focuses on element of the natural world. Acrophobia, fear of height. Thinks of someone climbing to a stair railing on the second floor of a mall. Astrophobia, fear of thunderstorm. The sound of thunder sends them hiding under blankets, even if the storm is miles away. Aquaphobia, fears of water, swimming pool, lakes, or even bathtubs can feel like dead trap. Situation phobia. This fear revolves around specific scenario. Claustrophobia. Fear of enclosed space. Escalator, MRI machine, or crowded train feel like suffocating trap. Aviophobia. Fear of flying. Even booking a flight can cause panic attack. Emetophobia, fear of driving. White knuckling the steering wheel on empty roads. Blood injection injury phobia, unique because they often cause fainting. Tympanophobia, fear of needles, sweating, dizzy, or passing out during a flu shot. Hemophobia, fear of blood. The sight of a paper cut might make them corrupt. Dentophobia, fear of dentists, skipping checkup for years, risking serious dental issue. Specific phobia, affecting 12.5% of people globally. While they might seem irrational, the fear is very real to the person experiencing it. While anxiety disorder dissociativity, physiotic disorder break from it entirely. Let's explore that next with Miss Pat.
Thank you, Ms. Tara. Hello everyone, my name is Trainee and today I will be talking about psychotic disorder. what they are, the different type, and the factor that increase the risk of developing them. Psychotic disorder are serious mental health conditions where people lose touch with the reality. They may experience hallucination, for example, hearing voices that aren't really there. Delusion, strongly held false belief like thinking someone is out to get them. Disorganized thinking and speech, such as jumping between unrelated topics or speaking in ways that don't make sense. Abnormal behavior is like unpredictable movement or being completely unresponsive, also known as catatonia. Now, let's look at the main type of psychotic disorder, schizophrenia. Probably, the most well-known is include ongoing hallucination, delusion, and thinking problem for more than 6 months. Schizoaffective disorder combines symptoms of schizophrenia with mood disorder like depression or mania. Brief psychotic disorder. It's sudden onset of symptoms that last less than a month, often that after extreme stress. Delusional disorder. It involves long-lasting delusion without other major symptoms. Substance-induced psychotic disorder, triggered by drug or alcohol use or withdrawal. Psychosis due to a medical condition, for example from a brain tumor, epilepsy, or serious infection. Like many mental health conditions, psychotic disorder don't have a single cause. They are usually the result of a mix of biological, psychological, and environmental factors. Let's start with the biological factor. Genetics. Having a family member with schizophrenia or another psychotic disorder increases the risk. Brain abnormalities, changes in brain structure, especially in the prefrontal cortex and hippocampus, can be involved. Chemical imbalance, especially with dopamine and glutamate, two important brain chemicals. Prenatal complications, such as poor nutrition, infection, or oxygen problem during birth. Next are the psychological factors. Childhood trauma, including abuse, neglect, or severe bullying. Cognitive issues like problem with attention, memory, or decision making. High stress level, especially chronic or extreme stress, which can trigger psychosis in people who are vulnerable. Now, let's look at social and environmental risk factors. Urban upbringing. Growing up in big, crowded city has been linked to higher risk. Social isolation, not having strong, supportive relationship can be a contributing factor. Discrimination and social adversity, such as racism or the stress of adjusting to life in new country. And finally, we have substance use and medical factor. Substance abuse. Drugs like cannabis, LSD, amphetamines, and alcohol can trigger or worsen psychotic symptoms. Medical condition, things like head injury, epilepsy, tumor, or infection like hepatitis can also play a role. Substance abuse and certain medical condition can also lead to psychosis. So, as we can see, psychotic disorder have many different causes, from biological and psychological to social and environmental. Now, I like to pass it over to my friend Noel, who will take us through the next part of the presentation. Over to you.
Thank you, Pat. Hello everyone, my name is Noel Yap Chun Wan. Today I will be sharing about schizophrenia, which is serious mental health disorder. So first, what is schizophrenia? It is a chronic and several mental illness that affect a person's thinking, emotion, and behavior. People with schizophrenia often struggle to tell the difference between reality and hallucination. It usually begins between the age of 16 and 30. Let's take a look at the main symptoms. First, positive symptoms. These are either experienced like hallucinations such as hearing voice, delusion, false belief, and disorganized speech or behavior. Negative symptoms. These include reduced ability to function such as lack of motivation, fresh emotion, social withdrawal, and difficulty managing daily life. Cognitive symptom, problem with attention, memory, and decision making. A quick note. Schizophrenia is not the same as multiple personality disorder. There's a common misunderstanding. Even though the current DSM-5 no longer use official subtype, the 5 historical types still help us understand how different people experience the condition. Like paranoid type. Many involve delusion and auditory hallucination. The person may feel like they're being followed or targeted. Disorganized type includes confused speech, struggling behavior, and inappropriate or threat emotion. Catatonic type involve abnormal physical behavior like standing very still, holding wood posture, or excessive movement. Undifferentiated type, a mix of symptoms that don't clearly fit into one category. Residual type, the person has strong symptoms in the past, but now only show mild signs. So, what causes schizophrenia? It's complicated. There's no single cause, it comes from a combination of factors. Biological factors, family history, brain structure abnormalities, and imbalance in brain chemicals like dopamine and glutamate. Pregnancy and birth issues, like poor natural during pregnancy, infection, or lack of oxygen at birth. Psychological and environmental factors, childhood trauma, high stress level, or growing up in a crowded urban area. Drug use, using cannabis, LSD, amphetamines, or cocaine during teen years increase the risk. To sum up, schizophrenia is a complex disorder caused by a mix of genetic, biological, and environmental factors. There's no one-size-fits-all explanation, and everyone experiences it differently. The more we understand, the better we can support those who live with it. That's all from me. Now I will pass it over to Miss Vicky. Thank you.
Thank you, Noel. My name is Vicky Wong Lee Fong. Today I'm going to talk about the theory and causes of mental disorder, how and why this condition develop, and how understanding them can guide us in treating them better. There is no one single reason why someone develop a mental health issue. In fact, there are a few different theories out there that each offer a unique perspective. Firstly, the biological theory. This look at the brain and genetics. The idea is that mental disorder can be caused by chemical imbalance in the brain or even inherited through our genes. For example, if someone has a family history of depression, they might be more likely to experience it too. Then is psychodynamic theory. This focuses on our unconscious mind. The belief here is that unresolved conflict from our early childhood can affect us emotionally later in life, even if we are not fully aware of it. Next is behavioral theory. This one takes a different approach. It sees mental health issues as behavior that we learn over time, often because of negative experience or environment. So, if someone grows in a stressful or unhealthy situation, they might develop certain behaviors that are not helpful in the long run. Then we have the cognitive theory. This one focuses on our thoughts. Basically, the way we think affects how we feel. So if someone tends to think in very negative or distorted way, like always expecting the worst or feeling like they are not good enough, it can lead to anxiety or depression. Now onto the humanistic theory. This one all about personal growth and self-worth. If the people don't feel valued or don't believe they are living a meaningful life, that can lead to emotional struggle too. Finally, the social cultural theory. This one look at the bigger picture. How our environment, societies, and culture impact our mental health. Things like poverty, discrimination, or unrealistic social expectation can all play a big role in how we feel and cope. Rather than relying on just one theory, most professionals today use the biopsychosocial model. This model integrates all three major factors. Biological factors like brain chemistry and the genetic, psychological factors like thought and emotion, and social factors like relationship and culture. This approach gives a more complete picture and help tailor treatment to each person's unique situation. Understanding these theories helps reduce stigma and improve how we support people. Treatment may include therapy, medication, community support, or a mix of all three. Thank you. Now I hand over to Kim, who will present about treatment and the conclusion.
Hello everyone, my name is Kim. We will explore the diverse approaches to treating mental disorders. From medications to therapy, these tools help individuals regain control of their life. Let's dive in. There are a few types of therapies. First, who provide the treatments? Clinic psychologists, the experts with doctors who specialize in therapy for conditions like depressions or schizophrenia. Second, psychiatrists. They are the medical doctors who prescribe the medications and offer therapy. Third is clinical social workers, focus on family dynamics and social challenges alongside counseling. Each professional plays a unique role in holistic care. Now, I'm going to talk about medical therapy. Medical treatments that target the brain and nervous system to manage psychological disorders. These approaches are used when mental health conditions are severe, chronic, or unresponsive to talk therapy alone. So they include treatments such as medications, electroconvulsive therapy, and even psychosurgery in rare cases. Let's explore each of these briefly. First, we have pharmacotherapy or drug treatments. This is the most common biomedical approach today. There are three major types of psychiatric medications. Anti-anxiety drugs like Valium help reduce intense panic and fear. Antidepressants such as Prozac help balance mood by increasing level of neurotransmitters like serotonin. Antipsychotics like Torozide help reduce symptoms such as hallucinations and delusions, especially in schizophrenia. It's important to note that these medications are not cures. They help manage symptoms, but long-term recovery often requires therapy, lifestyle change, and social supports. Next is electroconvulsive therapy or ECT. ECT is used in several cases of depressions, especially when other treatments have failed. It involves sending some small electrical currents through the brain to trigger a brief seizure. This can quickly improve mood in some people. However, ECT is not without risk. It can cause short-term memory loss and is usually considered a last resort. Lastly, there is a psychosurgery. This involves physically altering parts of the brain to treat mental illness. It's extremely rare today, but historically, procedures like the lobotomy were used improperly. These treatments often cause more harm than good. Today, we are far from cautious and ethical. Neurosurgical methods, if used, are highly controlled and only in very specific cases. I will walk through the main psychological therapies used to treat mental and emotional disorders. Unlike medical treatments, these focus on thoughts, behaviors, and emotions. First up is psychoanalysis, founded by Sigmund Freud. This therapy dives into unconscious mind using the techniques like free associations and dream analysis. For example, recurring nightmares might point to hidden trauma. Though used less today, psychoanalysis helps shape many modern therapies. Next is humanistic therapy, which focuses on personal growth and self-acceptance. Carl Rogers' client-centered therapy is a good example. It uses empathy and unconditional positive regard. A therapist might say, "I hear you, and you are not alone," creating a safe space for healing. Existential therapy, also humanistic, helps people find meaning in tough times, like coping with grief or big life changes. Behavioral therapies focus on changing actions through conditioning. Systematic desensitization treats phobias by slowly exposing someone to their fear, like spiders, step by step. Aversion therapy links bad habits like smoking with something unpleasant, say a bad taste, to reduce the behavior. Cognitive therapies help people change negative thought patterns. CBT, or cognitive behavioral therapy, teaches people to replace thoughts like "I'm worthless" with "I'm struggling, but I have strengths." Rational emotion therapy by Albert Ellis challenges irrational beliefs like "I must be perfect to be loved." Medications might stabilize a crisis, but therapy rebuilds lives. Whether it's CBT or anxiety or ECT for severe depressions, the goal is holistic care, healing the mind, body, and environment. In healthcare fields like optometry, physiotherapy, or radiotherapy, understanding abnormal psychology is crucial. Patients struggling with chronic illness might also face depressions, anxiety, or emotional trauma. Mental health is messy, complex, and so important. Whether it's understanding anxiety, schizophrenia, or phobias, it's all about seeing the person behind the diagnosis. Treatment isn't just pill or therapies, it's teamwork. Doctors, therapists, friends, and families, we all play a part. Let's keep breaking the stigma and talking openly, because everyone deserves support, not judgment. Thanks for hanging in there. Let's keep supporting each other, one chat at a time. Thanks for watching.